Hi, this is Dr. Bogner. Today, for Autism is Biomedical, we have Dr. Usman Singh here with us today. How are you, Anju?
I'm good.
Thank you for your time. Just a little intro. Dr. Anju Usman Singh is the director and owner of True Health Medical Center and Pure Compounding Pharmacy in Naperville, Illinois. She specializes in biomedical interventions for children with ADD, autism, Down syndrome, and related disorders. She has been involved in research regarding copper-zinc imbalances, biofilm-related infections, and hyperbaric oxygen therapy. Dr. Usman Singh is a member of the PANS PANDAS Advisory Committee to the state of Illinois. She also serves on the Medical Advisory Board for TACA, which is Talk About Curing Autism. I think the name has changed now. Autism Hope Alliance and Generation Rescue. She's a fellow, and I think you just mentioned executive board member for MAPS, which is the Medical Academy for Pediatric Special Needs. And Dr. Usman Singh received her medical degree from Indiana University and completed a residency in family practice at Cook County Hospital in Chicago, Illinois. She's also board certified in family practice and integrative and holistic medicine. So it's really a pleasure to have you. I wanted to talk to you for a long time, and just pick your brain about what your thoughts are on autism, what your approach is. So why don't we start maybe with how long have you been doing this, and why are you doing this? Have you always been doing this? Have you changed at one point? What's your interest, and what sparked your interest in switching into mostly special needs care?
Well, first of all, thank you for having me on your podcast and, being interested in asking these questions and putting it out there for the world to kind of understand our population that I, deal with on a daily basis. I came into this autism world in the integrative functional medicine, what we call biomedical world, working on the kids' medical needs in about 1997. I started working at a clinic called the Pfeiffer Treatment Center, where Carl Pfeiffer came up with this concept. It's called orthomolecular medicine, where you are using high-dose vitamins to work on certain enzyme pathways. And he was working with patients with schizophrenia, depression, ADD.
Dr. Hoffer, wasn't he part of that? Yes, I
Yes,
read
and
all of his
Dr.
work.
Hoffer.
Great.
Yeah, and Dr. Pfeiffer. And then we started I started working with Dr. William Walsh or Bill Walsh in children with autism and studying copper zinc imbalances in them. And we found like in over 400 children that we looked at, 99% of them had high copper and low zinc. And then you start asking the question, why? And they had like specific symptoms of poor attention, poor focus, poor concentration. That was very common in that population of high copper and low zinc. So I kind of started there. And then my own kids, I know you have, I don't know how many children you have. Four. Me too.
Oh, God bless you.
Me too. I had four children. And my eldest daughter, she she started out with peanut allergies and dairy and gluten allergy and corn and soy. And this was in the 90s. She was born in 91 and no internet, no Whole Foods. And I'm trying to figure out how to feed this kid. And I'm in residency at Cook County Hospital, and nobody's believing me that my daughter has asthma and allergies. And I mean, I understand what these families go through when people don't listen to them and, hear what they have to say. So my daughter Priya had those kinds of issues. And then Nika developed type 1 diabetes and allergies and asthma. And then Vanya has chemical sensitivity. She couldn't go to school. She can't go to public
So,
places.
so you suspected early on this wasn't there before. This
No.
happened, and nobody believed you, and so that's when you took things into your own hands. Is that what you're saying?
Yeah, yeah. And then and so those three were just kind of teaching me like what do I do? I'm talking to my doctor friends, I'm talking to people, and nobody has any good solutions for me. And then the question is why? None of this is in our family. And why all of a sudden are my kids having all these issues? And again, this is in the early 90s. And so then I started looking for answers, and that's why I started working at the Pfeiffer Treatment Center, and I started working with children on the spectrum, and it just kind of like it just became a deluge, right? Like when I was in residency, it was 1 in 10,000 kids. And now, what are the numbers? It's so crazy. I got scared when it was 1 in 500. Then I got even more scared. It was 1 in 100. And then I was like 1 in 80, and then 1 in 75, and then 1 in 50, and then like 1 in 38. It's
One
just,
in
it's,
22
we
in
have to ask
California,
the
right?
question. We have to ask the question.
Wow, wow. And so you worked for the Pfeiffer Center. What did you guys do around that time? I mean, you studied the zinc and copper. Uh, how did that expand? Oh, because I know you're doing a lot of other things, obviously,
Hmm.
in the biomedical testing world and treatment world. But how did that evolve? Like eventually, I think you started your own
Clinic.
practice,
Yeah.
um, and so what do you think has kind of opened your eyes to the realization that, oh my God, we can help these children. There is improvement when everybody else said, no, 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 ABA, OT, speech, that's all you got to do. What opened your eyes like early on for you to keep going? Because it's frustrating, right? If you don't have results, people will either move on or you're like, I don't want to do this. But what happened? Where did you see early results, even if it's not recovery, but maybe just some improvement?
Yeah. Working there at Pfeiffer, we also had this concept that Carl Pfeiffer developed. He called it like high and low histamine. So he would call it histodelia and histopenia. And his theory was people who could methylate, they could get rid of the histamine, but people who are under methylators, they couldn't get rid of the histamine. So we kind of shifted that terminology from histopenia and histodelia to under and over methylation. And again, in the early 90s, we were talking about this. Now we have more genomic tests that we can kind of figure out like what's going on with methylation. But as you mentioned, you start working with these things, and um, you know, giving zinc, for instance, helps the attention. But then I'm still dealing with other issues. And so then what? And then we start working on methylation, maybe help with cognition and language and processing. And then we're learning about, okay, there's metals in the environment that may be affecting the brain. So when I was at Pfeiffer, I started kind of expanding my thoughts. And then a lot of the kids that came to me had GI issues. They had GI issues, severe, bloating, constipation, pain. They would posture, they wouldn't sleep. I remember one case where I know the kid was waking up in the middle of the night with severe pain. Um, Seemed like reflex, but they're nonverbal. They can't tell the parents what's going on. And even kids, kids don't have that vocabulary to say it's burning. They just don't, they might cry. They don't feel well. And so I sent this particular child to the GI doctor, and the GI doctor called me and said, "This is night terrors." And I said, "This is not night terrors. This child is in pain. They're having aggression, they're having self-injury. You know that this is pain. You cannot ignore it and call it night terrors." So in 2003, I left the Pfeiffer Treatment Center and started my own practice, which is called True Health Medical Center, to try to kind of expand my, how do I manage these cases? And then in 2007, because my own kids were having like issues with it, um, chemicals, ingredients and things, they're super sensitive. Actually, in 2003, my daughter Priya, with the peanut allergy, she passed away.
I'm sorry.
And it just kind of, it just hit me really hard, of course. And I just like, my daughter pretty much self-destructed from not even eating a peanut, but just by being near a peanut. And I think of my patients and I think about how sensitive they are. They're sensitive to chemicals, they're sensitive to metals, they're sensitive to mold, they're sensitive to emotions. They're extremely sensitive people. And so I think if my daughter could self-destruct from a peanut, imagine how my patients are feeling from everyday insults in the environment. And so in 2007, I started a compounding pharmacy just so I could make clean products for my kids and my families and my patients. So, and so I've been at True Health now with
Does your
21
compounding
years.
pharmacy dispense out of state of Illinois?
Yeah.
Okay. And
Yeah, we have licenses. You have to have a license in the state that you dispense to. And so any state that we can dispense to, we have licenses in those states. So we
excellent.
have
That is called the
licenses.
pure compounding pharmacy, right?
Yeah, we have licenses in over 15, 20 states or so.
Amazing idea.
Mhm.
Amazing idea.
Mhm.
So just to keep
Yeah,
all of the fillers and dyes and colorings and unwanted ingredients
right,
out of, yeah.
right.
So
We try to
that's
eat clean, right? We try to, but it's so hard because all our food has things in it and our medicines have things in it that our body has to process and detoxify. And, my patient population is not good at getting rid of stuff.
right. So, over the years, at least in my practice, I used to do a whole battery of testing, $2,000 worth of oat and neurotransmitters and mold and parasite. What is your approach currently with all that you have learned in regards to, all right, how do you approach a patient? Obviously, you have to talk to find out about the history, but what do you usually do? And I know it's highly customized depending on the situation, but what are some of the best tools that you have that you think will give you answers that are actionable, with results?
Yeah, over the years, you kind of go through phases.
Same here.
Phases of things and you're like, oh yeah, 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 this is it. And then you kind of figure that out and that's it for a certain population. And so you mentioned the word individual. We all are different. I even say we're kind of all on the spectrum in a way. We all have our nuances, we all have our quirks, we all have our things. But our my patient population just has to deal with a lot more than um, you or I do. So I do kind of, I always start off with, like, as you mentioned, a history, and I'm really trying to look there what was the trigger? Because we get that history all the time of, okay, my kid is doing fine, 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 fine. And then we have a regression, and now our immune system has what I use the term tilted. We've lost tolerance. It's a total immune lack of tolerance. And all of a sudden the immune system says, mm-mm, mm-mm. And there's like a defining time and there's a defining history of that. And for some people, you get the history and they lived in a moldy environment. And some people you get the history where they had a lot of antibiotics and it disrupted their microbiome. So I think for me, that history and figuring out the triggers and then doing like specific tests based on that. But but overall, kind of my approach is um I feel like my goal is to try to balance the individual. I don't even know, I don't even care what the diagnosis is.
Mhm.
So you don't even need a diagnosis, right? What you come to me and you have symptoms like I don't feel well. I have headaches. I have abdominal pain. I can't think clearly. I can't sleep. I have anxiety. I have depression. Those are all symptoms. Our goal is to figure out why you have those symptoms and make you feel better. So I don't I don't even care if I'm not treating autism.
It doesn't mean anything, right? So,
Mm-mm. No, it doesn't mean anything. I'm not treating ADD. Those are just symptoms.
mhm.
Those are just symptoms. What we're trying to figure out is what's causing those symptoms. And I think anybody with a chronic issue, when we can say a chronic illness or a chronic itis, which is inflammation, anybody with chronicity has inflammation somewhere. If it's in your lungs, it's bronchitis. If it's in your skin, it's dermatitis. If it's in your brain, it's encephalitis. It's in your gut, it's colitis. So again, my approach would be what's causing the inflammation and then obviously avoiding those potential triggers, and then trying to figure out how to balance the body. And that's the hard part. How do you get the body back? How do you get the immune system back in alignment? And so that takes a little tweaking, but we start with number one, clean up the environment. We don't want to put more junk in it. I call it garbage in, garbage out. We don't want to put more garbage in our body. We're trying to get our bodies to heal. So don't put any more junk in your body. Cleaning agents, soap, shampoos, detergents, fragrances, BPA, phthalates, triclosan, plastics, the list goes on, but it's a tough one. And I tell people, okay, I get it. You can't be perfect, but there's some things we can do.
Mhm.
Clean air, clean water, clean food. I think the number one treatment that I've found the most helpful for people is diet. If you're
Yeah,
going to eat at McDonald's and you're going to eat crappy food and you're going to expect to try to be healthy, it's just not going to happen.
absolutely. I agree. But I
It's
love
just,
your approach, kind of get the basics at least under control before you even start to tackle the biochemistry of each individual. Because otherwise you just keep feeding it, right? And you're chasing a carrot.
oh
So
yeah, yeah. It's like I also give like the tree analogy. I mean, we can treat the branches, but we really want to work on that
and the
the
roots.
trunk,
Yeah.
right? And so like, okay, I can go after methylation. I can order a genomics and I can figure out the pathways and I can tell you, this is where your little enzyme defect is, and I can get that micro. But I think again, when you're starting out, you really have to start macro.
Mhm.
You have to start with these kind of macro ideas about what's happening.
Oh, what I found interesting is that you mentioned that, but with the gut. And I think there are studies that show up to 95% of kids with autism have gut issues one way or the other. I think the more general consensus is at least, I think, about in the 60% range. Um, and then, we have the dietary interventions. Everybody has a little bit of a different idea. Obviously, clean, but is it the GAPS diet? Is it the NEMCheck protocol? Is it a keto diet? Do you think that is enough? Even if you find kind of the parents are changing the diet, they're doing a great job, do you think that is enough? And if not, why not?
So early on, I feel like, in the 90s, when I first started doing this in the early 2000s, we would have those cases where it was enough, where we would put them on the diet. We call it, a low inflammatory diet, because the concept behind some of these kind of mental illnesses, we can maybe put them in a category: anxiety, depression, ADD, ASD. They call them mental illnesses, but you and I would say they're medical.
Right.
They have mental symptoms again, but the basis is medical. With these mental symptoms, it's again comes back to inflammation. Inflammation triggering excitation in the brain, and that excitation manifests as poor attention, poor focus, anxiety, OCD, stimming. So inflammation, the most inflammatory foods, we would guess sugar, dairy, and gluten, probably sugar, gluten, and dairy in that order. And so when they surveyed over 10,000 families with kids with autism, the most helpful biomedical intervention was a casein-free, gluten-free diet. And 80% of those 10,000 people reported that it was helpful in some way or the other. So I think to me, that is kind of a basic diet. You mentioned other diets like GAPS or keto or SCD over the years, a
Meat diet.
histamine diet in certain people. Again, you kind of have to maybe take those cases where you're not improving and then go a little deeper with the diet. With certain people have oxalate issues, and we have to do low oxalate diets. But my next step in my program is, clean up the environment, clean up the diet. Number three, before I do anything, is work on the gut. I call it clean up the gut. And we'll use, that as a broad term, but what we really see is this gut-brain disconnect. and that the microbiome or the bacteria in the gut has been so disrupted that the signals between the gut and the brain are then disrupted. And I think when I tell parents, where do you think most of your neurotransmitters are made? And everybody's like, brain, brain. And I'm like, no, gut. And they say that I think that the gut is the first brain. They always say your gut is your second brain, but I really think that your gut is your first brain. A lot of this stuff, really, we're finding dopamine issues with Clostridia, different bacteria that we've been testing and finding overgrown. They really, really affect the brain.
So you said you have this tool available, to clean up the gut. What is your approach to that? So obviously first, and I think that's amazing, to clean up the macro environment. How do you tackle that in regards to the gut, or patients not responding to the diet, see no improvements, or they see little improvements and then want to go to the next step, see how far they can push it. What are some of your tools that you incorporate for those individuals?
So I think, you think of the gut and you think, okay, what's the gut doing? How do you get food and nutrition from your gut? So we have to think about digestion. How is the patient's digestion? Are they digesting the food? So say if we did a stool test and there's fat in the stool, we know they're not digesting fat. Or if we did a stool test and we see like fibers of, carbohydrates and plants, we know they're not digesting that. So digestion is really important. And that digestion starts in the stomach. That's where we digest our protein. And then the food goes in our intestines, and that's where we digest our carbs and some of our fats. So making sure that's all happening is important. The other thing is there's this gut lining, and the gut lining helps us absorb our food. And sometimes you'll see these kids and you can kind of see their malabsorbers. They're super thin, they have dry skin, they don't have any muscle mass, they don't have any fat on their body, they're not growing. So again, what's happening in the gut? What's happening in that, to that microbiome? And so we have tests. We call them specialty tests. So, in traditional medicine, they might have stool tests, but they're looking for pathogens. They're looking for bacteria that's going to cause diarrhea. So they might look for C. diff or salmonella or E. coli or something like that. And they don't have a good ways of figuring out digestion and absorption. But I would say, I call it my world. In our world of integrative medicine, we have these specialty labs that we can do. And for the gut, the two big specialty labs would be a stool test. And the stool test would hopefully look at digestion, absorption, inflammation, what we call dysbiosis, good bacteria, bad bacteria, yeast, parasites, and then this 16S RNA testing where we can actually look at the microbiome and look at the balance of bacteria. So that's stool. And the other is urine. And in the urine, we can do something called an organic acid test or oats test. And that is metabolites in the urine that tell us a little bit about the gut. And those metabolites that one is good to tell us metabolites of different kinds of fungus that might be growing in the body, or candida. And the urine test is really good for different types of Clostridia that might be in the body, because the stool testing isn't that great at that. So also the oats test tells us a little bit about how we're managing clearing oxalates. And there's some other markers I like on the oats test that tells me about mitochondrial function and some other fatty acid metabolism. So those two tests are kind of like my go-to for figuring out the gut.
I'm absolutely fascinated about what you're talking about, Anju, and it's to me very surprising that my pediatrician doesn't. So why do you think, with all that what you just laid out here, the complexity of just one organ system, which is the gut, why is my pediatrician not talking about this? Why is this not being adapted? Obviously we have newer technologies, sequencers and genetic testing and genomics, but why is this not being adapted by the AAP, for example?
I think it's because it has kind of stayed in the specialty world, and we don't have a lot of great studies on, what does this all mean? So again, if we have digestion issues in traditional GI world, they don't use digestive enzymes. They only use it for, say, patients with cystic fibrosis or severe malabsorption. So, it's kind of like a gray area where they're very black and white and where they utilize some of the tools. And then the tools they use, say somebody comes in with small intestinal bacterial overgrowth. They do a breath test and they find hydrogen or methane bacterial overgrowth. They'll give them an antibiotic and send them on their way. And then we kind of say, the antibiotics might bring the bacterial load down, but what's causing this problem, and why do you have poor motility, and why is this bacteria overgrowing, and is there some toxicity in the liver, and maybe we can use herbs, and so again, I think that they need to come a little bit towards our place where we are, and we probably need to kind of get more research, get more studies to find a common ground where they kind of can understand this. It's funny, but I have GI doctors referring to me, and neurologists and psychiatrists when they can't help their patients, they send them, well, consider me a last resort. But I think it should be opposite. I think that this kind of
Mhm.
treatment should be first resort, and then having to go to the pharmaceuticals and the strong meds would be for last resort.
Or Miralax, that's a big one in the
Or
GI,
Miralax.
right? Just get it all out with Miralax.
Yeah, that's a good one.
So what do you see in your practice with your patients? What do you see? Are you satisfied as a physician of the progress that you see? Are you amazed at what you see? How does this how does
I
this
feel
affect?
like I feel like early on it was a little bit more satisfying. I feel like the kids were less toxic and less difficult. I see a lot of immune issues and autoimmune issues that are really hard to completely reverse. So I kind of look at it as a bell-shaped curve that, about 80, 70, 80% of my patients, they do better.
Mhm.
And then I have those 10 or 20% that maybe I'm not so good on one end. And I have those 10 and 20% that we really got them. We got them. And
Well,
it's just amazing. We had a family come in this week, and they said when they came, they didn't think their kid would get better. They really didn't. And she walked in, and I was just amazed and just talking up a storm, just perfect,
that's
perfect.
amazing.
Could
And again,
not, could not tell, could
again,
not tell.
when you go into these groups or forums on social media, and the question is raised, hey, I just got diagnosed with autism, who should I see? And you get all of these opinions, but one thing that always comes up is Dr. Usman. So I just want to reiterate, you are really on the top of your game, I have to say, in the community. And I have to say, we have to thank you so much for all of your work, of course, and your dedication and your perseverance and your love for these kids. And hearing these numbers is just incredible, because our message is autism is biomedical. We have to fight this narrative that we need to normalize this. And I wanted to ask you about this. There are groups that are very aggressive, towards our cause, and in fact, we had a very aggressive person just message us last week for Alex, actually it was a death threat.
Oh,
And
no.
because he was autistic and he doesn't appreciate that we consider this to be treatable, because they're pushing for neurodiversity and even autism pride. What are your thoughts on that?
Yeah, I mean, I guess it goes back to the concept that we're not really treating autism. So it really goes back to that. Like we are treating the individual and we're treating their medical issues, and they happen to have autism. So again, we can't cure autism, whatever that is anyway, right? Like we haven't really defined
That
what that
is probably the
anyway.
best answer I've ever heard on this subject. So kudos to you. That's brilliant. We're not treating autism. What does that even mean, right? We're treating the symptoms. I'm a physician, so
Yeah.
great. I
And
love
I'm
it.
not even treating the symptoms because that's autism. That's a symptom. But I'm treating, you know, if you're fine, you're going to Harvard in Berkeley and you have autism, kudos to you. Like fine. I praise you. I mean, couldn't be easy. It couldn't be easy. But if you came to my office and you saw how much suffering I see with severe anxiety, they can't get out of the car, they can't talk to people, the OCD just takes over and they just cannot function. And they're brilliant. You and I know how brilliant they are. They're just brilliant. And they pick up on everything. They can teach us so much. They're here. I think a lot of them have taught me, my daughter, I mentioned she passed away. She wanted to be a doctor, and doctor means teacher. And Priya has been my teacher. My kids have been my teacher. My patients have been my teacher. Their parents have been my teacher, the doctors that I work with. And so I feel like it takes a village. And I praise the neurodiverse community. I say take pride in who you are and what you are. But if you have medical issues and you don't feel well and your stomach is bothering you and you can't digest food and you have headaches and you have anxiety and you have severe OCD that's taking over, then don't ignore it because you say you have autism. Same with like Down syndrome people. A lot of that whole group too are like, oh, wait, we have trisomy 21. It's a genetic issue. Well, am I going to ignore my heart problem? Am I going to ignore my hypothyroidism and just say that's because of my Down syndrome, or am I going to ignore my gut issues? No. Uh, One of my pet peeves is when my patients go to doctors and all they see is their autism. Yeah, they have autism, but they have neuroinflammation, they have GI issues. A lot of them miss hypothyroidism. It's so easy not to miss, check a TSH, but they don't even do that. They don't even do that. All they see is autism and then they just ignore the person, they ignore the body.
I think it is largely also has to do with, they have 5 patients waiting in a waiting room. This is not a discussion you can have in your 15-minute insurance covered well visit, right? Um, it's just assembly line. Oh, you're due for your vaccines. Any issues? No? All right. See you in 6 months. Um, no,
Yeah,
it's
I think there should be I don't know. Well, they get the diagnosis. Sometimes they'll have an MRI, sometimes they'll have like chromosome tests, but they never have any blood tests. I mean, check a
never
CBC, check a CMP, check a thyroid level, check their
ferritin.
cholesterol, check their zinc, check their vitamin D. I mean, that to me would be kind of, you know, we know that some of them have carnitine issues. Check a carnitine level, check a folate level, check a B12 level. Just do your basics at least.
I agree. I agree. It's very sad. I found a lot of children have low ferritin levels, the iron
Yeah,
storage,
iron, lead.
lead, right? Venus. I agree. And do you think this is going to change? Is anything, or how can we change it? What can we do?
Like I said, I've been doing this with my daughter since 1991, with my work since 1995, and I keep thinking it's going to change. And you know how they say it's going to take 20 years now. It's been 34 years for me. But I have seen the shift. It I have seen the shift. I mean, people are just much more aware. You can get all kinds of medical advice on TikTok.
Yeah.
But if us doctors try to say something like that, it's a big problem.
Yeah, for sure.
It's a big problem. You get some influencer saying, oh, take this vitamin or take this or that. Oh, that's okay. Or you could go to Whole Foods and get somebody to give you advice on everything. But, if we say, oh, well, maybe you should take some vitamin D for your immune system.
Yeah,
Heaven
good luck.
forbid.
Yeah.
So I
And
do think it is shifting, but the doctors have to change. I think the community is changing. The community is getting aware. The people are demanding more and more of this kind of approach to individualized medicine and personalized medicine and anti-aging or whatever we want to call it, functional medicine. But it's basically treating the underlying problems.
amazing. Well, I don't want to take too much of your time. I think this was a fascinating discussion. Your wealth of knowledge. I think we could talk all day. Dive into, subcategories of biochemistry and all of that. But I think the message is pretty clear that you're tackling this problem. Many others don't, and we're very thankful for you in the community. You're very much respected, and so for any new parents out there or somebody that kind of has given up or wants to give it another shot, are you taking new patients? Where can we find you?
I'm in Naperville, Illinois, which is outside of Chicago, at True Health Medical Center. But my goal is to raise awareness and educate other doctors to kind of um, move this forward. And so, as you mentioned in the bio, I'm involved with Medical Academy of Pediatric Special Needs, and we definitely are trying to train uh, nutritionists, healthcare workers, nurses, PAs, chiropractors, nurse practitioners, doctors, anybody who wants to learn um, to kind of help treat our children with these kind of special needs and special conditions and chronic illnesses.
Amazing. Well, I don't know how you do it all, but thank you for your contribution, for helping our children. We truly appreciate it. We have people like you um, in our community. So, with that being said, thank you so much for your time. And I'm sure we're going to speak again in the future. And that's pretty much it. You have anything else that you wanted to mention, Anju?
No, I just wanted to thank you. And I like to tell parents to always follow their heart. There's a lot of you get so much information from all over the place, and sometimes just center yourself and really, really listen to yourself because you'll know what to do.
Beautiful.
Mhm.
Well, God bless you and thank you and have a great day, Andrew.
Thank you.